sits? The sits, okay. What part of the sits would you like today?
The supraspinatus?
The supraspinatus, okay, we'll do the lateral rotator kind of stuff, okay? So what could I do there for strengthening in that case? Let's see, here is what? This is muscle length, right? And coming back this way, it's strength. Oh, look, the available range. So what can I have her do? Okay, I'm going to have you push back against me. Come on, let's push back and have her work all the way through range. All the way back. Come on, come on, come on, come on, come on, come on, come on. End of range. And now what? That strengthening was what? Concentric, eccentric? Concentric. This is where it gets to be a little bit more fun. Now say, I'm going to go ahead and try to move you back the other way. I want you to let me win, but give me resistance. Okay, nice and smooth, nice and easy. And this takes a lot of control on behalf of the patient. All the way down, okay? So now I'm just getting just the glenohumeral joints with a manual resistance. But I could ask her to do what then as well? Take that shoulder complex. I want you to really take that scapula, tuck it underneath there. Maintain that scapula right there in that position. Don't let that scapula move at all. And now, by keeping the scapula down and back, do the exact same thing. Pull back for me in the lateral rotation. Here, keep going. Come on. Hard, 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 hard. And now let me wing come back this way. So I'm getting what for strengthening here? Not just the dynamic motions of the rotator cuff, but I'm also getting the stability or static considerations of the scapular stabilizers, right? How can I make this more difficult, more functional for the person? Don't move. What does she have to do? I want to do something with the shoulder complex, make it more functional. What do these muscles help to do? The sits muscles? I know you guys know this because we talked about it one time last year at least. Because I have what in this case? This is my scapula, right? Here's these guys here. As this goes up, right? These guys all coming up here. Here's the spine of the scapula. These guys have to do what to the head of the humerus? I have what type of roll is this? I'll write it in. Superior roll, so that includes what? I have to have what?
Inferior slide.
Inferior slide. Okay, so I have to have some type of depression of the humeral head when I come up overhead, right? So what happens here with someone like Melissa, I say what? Let's go ahead, keep that shoulder down back. I'm just going to have her do it. This is a very helpful little exercise here because if I reach up overhead, right, what does my rotator cuff have to do? Help with depression of the humeral head you just told me, right? So, what's the difference here, giving resistance, versus if she's coming up like this? I give resistance out here.
It's no longer a lever arm.
Here I'm very close. She's just going to punch up. Very, just relax. Go ahead. She's going to just come up like this. What happens here is she goes past her shoulder. What does that say about the external lever arm?
Shorter.
Very short versus way out here, okay? So I can go ahead and say, okay, Melissa, here we go. I'm going to have you work at keeping that scapula down and back. I want you to punch up overhead, but I don't want her to do any of this abduction here. Oh, hold on. Stay right here in line. Come on up. Keep push, 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 push. That's it. All the way up, all the way up. Now keep that scapula down and back and let me win coming down. Okay, keep going, keep going. What am I doing here? I'm providing manual external resistance, okay, through range. Concentrically as she punches up, eccentrically as she comes down, okay? I give a lot more feedback and I know a lot more about how she's doing than if I turn around and say, oh, Melissa, guess what? Take this home and go at it and just punch, up, down, up, down. That might be something that we work toward, but I would think if you want to look at progression, I work through something like this. I ask for feedback while she's doing it. Do you have any pain, any sharp pains up front here? Okay, doing all right, nice and smooth and easy. If she's able to do that, that tells you what as far as when you send her home for the rest of the, 98% of the time during the week when you have PT or don't have PT. She's going to be hopefully a little bit more ready to do something like that. So you've checked her, hands on to that point. Make sense? But that's what I want you to try to work at. Now there are multiple parts of the body you can work with here. I'm going to have you kind of start with the shoulder complex here. We're going to be reassigned varying groups a little bit. And you're going to job is going to try to combine exercises to include all those little muscles associated with Boston. Make sense? So any questions we have there? I have you work here on the concept we just did here of like rotating cup strengthening and then moving up overhead, down and back. Quality matters, right? Look for substitutions, look for compensations, any type of quote cheating. Make sure that form is done appropriately. Questions on that? We good? You guys want to add anything? Okay, so let's go ahead and work with some